Mulimo eh? Eh.
Kulaga nekito kuri RD Congo. Aina tukaiba kutunanzibwa bwa okusomesya ngalo kusukanya n'abantu batu abikwata ngalo bulwaye bw'Ebola muri Congo.
My name is Mugenyi Adam. I'm a Red Cross volunteer. This is my community, and you see the communities are worried. Whenever they see this Red Cross, they see us, they are worried. They know we are close to the outbreak. They know we go field in where the outbreak is. So some fear even coming close to us. I said, no, we don't have the infection. I tell them the signs. So after some, they say, yes, thank you, because we didn't have this, we didn't know these signs. Some actually appreciate, the number appreciates. Some say Ebola, Ebola is not real. Some people say it is the Western something. They came from the whites. They want to finish all the Africans, but you tell them, please, don't ever think like that. Ebola is real. So after, it's when they realize that this thing must be treated in the hospital.
We would like to see communities that can easily detect diseases, potential epidemics, or communities that can respond in case these epidemics occur. But more importantly, we want communities that can actually prevent these epidemics. And we are doing this through volunteers. And these are community-based volunteers that are obtained from the community.
More and more we're seeing epidemics and pandemics. So we have seen in the last 5 years cholera, Ebola, Zika spreading through different continents across the world. So we need communities to be more prepared to stop these early. We can halt the spread rather than reacting once these have already become epidemic proportions. As the Red Cross, we're very strong at mobilising to support communities when something happens. We're one of the first who are there to take action. But we can do better than this. We're there also before the epidemic. So the new program, operating in 8 countries globally, 7 countries in the Africa region and also in the Asia region, funded by USAID, is really driving towards preparedness. Communities are prepared, societies are prepared so that we can stop this early.
We are looking at risk communication, Ebola risk communication that is being done by the volunteers, improving community awareness, and we are also doing community-based surveillance by these volunteers. We are working closely with the Ministry of Health. This project is not there to substitute the existing surveillance system, but it is meant to complement the surveillance system.
This CP3 program is actually identifying a problem at its source so that we can limit its spread. We keep it there. We can use even few resources by handling it where it is, than letting it first escalate, and then we begin bombarding ourselves looking for ways here and there.
It was one morning, I visited 1, 2, 3, 4 houses. So that woman's house was the 5th. So I explained the Ebola facts and whatever, signs, transmission, prevention. As I was going, a few meters, the woman called me back. Mzee, first to come. Say, what's the problem? Say, my grandchild had stomach pain in the night. And then in the morning, she dilated blood stool. I asked how often. The stomach pain started at 3. So immediately I called the supervisor. Said, please, I have a case. One of the community members I showed some signs of ABCD. Say, okay. Immediately they came. After coming, they interviewed the grandmother with the girl who was sick. So the interview they gave and the answers the woman and the child was giving explained the situation that it wasn't Ebola. So they discovered some malaria and whatever. I continued visiting the grandmother, and what gave me the pride was the speed, was the response. The response was so fast and perfect.